Welcome back. Well, guess what? That school year will be here before you know it. And doctors, parents say an item on your back to school checklist actually needs to be vaccines.
Joining us to talk about the importance of getting your child vaccinated is family physician Dr. Christopher Scuderi. Thanks for joining us this morning, doctor.
Thank you so much for hosting me this morning.
Absolutely. So COVID-19 vaccines now available for children of all ages. What's the conversation you're having with parents about whether they should or shouldn't get their child vaccinated?
So we want parents to know that these vaccines are safe and effective. They've been approved now for ages 6 months and up. There's a couple key points I want parents to know about the vaccines. The first is both the Pfizer vaccine and the Moderna vaccine were approved for age 6 months and older. There's a couple key differences between the two vaccines parents should be aware of. The Moderna vaccine is a fraction of the adult dose, and it's given in 2 doses 4 weeks apart. The Pfizer vaccine, also a fraction of the adult dose, but it's given in 3 doses. The first dose is given 3 weeks, and then the second dose, and then the third dose is 8 weeks after that. And so it's 3 doses total. The third dose is not a booster. It's part of the primary vaccination series. And so it's important that parents make sure that their kids receive all 3 doses if they do the Pfizer vaccine. The other thing we want parents to know is that if their child is 5 years old or older and it's been 5 months since they've had their original COVID-19 vaccines, they're eligible for a booster, and we recommend that they get that.
Dr. Scuderi, let me ask you, because a lot of parents that we talk to, they might be hesitant about having their child vaccinated. What do you tell those parents who come in and they're just being very, just honest about it, that they might not want their child to be vaccinated?
So as a parent, I understand those concerns. We want to do what's right for our children. We want them to, grow up to be healthy and to have great lives. And so, I talk to my parents about the COVID-19 virus, that it's unpredictable, and we do not know which children may have long-term COVID, may need to be hospitalized, or may even die from COVID. And so when we look at what tools we have to best protect our children, the COVID vaccines are one of the best. They're great at preventing severe disease, hospitalization, and death. And so I let parents know, if they look at the data, these vaccines are safe and effective, and that if they have any questions, I would encourage them just to make an appointment through family physician and discuss it with them. They're a great resource, and physicians, I've really enjoyed over the past couple of years talking to my patients about their concerns and really trying to help them with their decision.
What about the timeline? If the goal is to be fully vaccinated by the time you go back to class, when should kids start thinking about getting those vaccines to make sure that happens?
So I would encourage parents who are listening today to make these appointments now, and there's a few reasons. The first is, typically at medical offices, the week or 2 right before school tend to be really busy, so you want to make sure that you can get an appointment. The second is, some of these vaccines that we do give to children are in series, so they may need a second dose. And so if you want your child to have peak immunity, scheduling the appointments now really helps out. And the third is, for that group of parents that do have questions or concerns, make the appointment, talk to them. Your physician's a great resource for you.
Well, Dr. Scuderi, we appreciate your insight today. Thanks so much for joining us here on News 9 at 9.
Thank you so much.
Have a good day.